people together. This is what we do. This is who we are. Okay, very good. Helena is very interested in this and has a number of highly experienced community health workers as well, which is really important. Then the other one who couldn't come today is the newly hired UIA, a community organizer. Her name is Raylene Barboza, and she's now still working on the end of the Earn Sick Time campaign, so she couldn't come, but she would have wanted to be here. And then we also have Father Jack Oliveira, right down at Our Lady of Mount Carmel, who's very interested in this, as well as some of our UIA membership from St. Michael's down the other end, okay, down there, who are also very interested in investing in this because those are the two largest Portuguese speaking parishes that we have in the diocese in Fall River and New Bedford. Okay, and then I have every confidence if we continue to outreach to some of our others. So for example, I know at Stewart St. Anne you're outreaching to Santa Cristo. Santa Cristo is now becoming more invested and involved with UIA as well. So what we're seeing now is that a lot of our culturally specific, bilingual, bicultural communities are coming. This is a great opportunity now for us to outreach to them and vice versa. So that's all of our regrets for the moment, but people that we have every confidence will be part of this moving forward. So, there you have it.
Great. And so I know we're running a little bit late, but I just wanted to for us to go around and introduce ourselves.
What we do. Okay, very good.
Yeah, just to get an idea of who's in the room. And so I'll start by myself. Ana Galeas. I'm the program manager for this project. And I'm very excited to start and meet you all. I know I've been hearing so much from Ilali about, especially Miss Kathy and all the great work that's being done here. So
I call Kathy Dynamite Kathy.
That's right. Dynamite. I'll be sure to say that. That's right. You might as well get it straight.
This way or that way?
Okay, we'll go this way. Your turn.
So, Maria Idali Torres, I'm the director of the Gaston Institute, and what is called the PI, although this is not a research project, but in general that's what the university call it, of this project. I met Ana Galeas about 3 years ago when I began working with some Latino Catholic parishes and with Dr. Hosman Ospino at BC. I don't know how many of you know him, but he's a Latino theologian. And Jennifer Allen, and we began doing cancer screening education in some of the Catholic parishes in Massachusetts. The Catholic parishes that have a Spanish Mass. We up until now we haven't not worked with Portuguese-speaking faith communities. Our experience has been mostly Spanish Latino churches.
My name is Chris Jimenez. I'm an intern right here in the Gaston Institute. I'm working as a program assistant with Anna, and I'm in charge of whatever she needs. And we do a lot of research on what programs have been done in the past, so we can learn some strategies to manage the program as well. And we're doing a lot of research and getting resources to get informed.
Tell them a little bit more of yourself.
Right now I'm a health science major, so anything about nutrition and fitness, I'm an expert on it. I'm also in the Army National Guard as a human resources specialist, so I'm very well experienced with all the benefits of the military. And right now I'm just looking to graduate for a public health school.
Good for you.
Yeah.
Hi, my name is Chanel Fields, and I am an intern also at the Gaston, I'm a program assistant for Anna in Italy, so whatever she needs, I'm here, whatever you guys need. I'm also a health science major with a concentration in public health, and I'm going to grad school next fall to pursue my education in emergency health preparedness. So that's the area I want to go. And should I talk about the other thing? I also work with Dana-Farber Cancer Institute. We work with the faith communities in Boston on how to plan health activities, events to lower cancer disparities in those communities, specifically in the Latino and Black communities.
Like this.
I'm Christina Brinkerhoff. I am the project monitor and evaluator. I just recently graduated in applied sociology at UMass Boston. I also graduated then with my undergrad in sociology, and I've been working with Ida Lee since forever, since my undergraduate.
There you go.
Yeah, I worked with her in the Para um Futuro Mejor, Springfield, the Latinos in Massachusetts, focusing Springfield. I have also worked with her with Pura y Dicen. And right now, like at the same time I'm working in this project, I am working with Professor Eduardo Siqueira, like with Brazilians and health disparities.
And you come from?
Brazil. Born and raised.
And you come from?
I come from Colombia.
Very good.
From Puerto Rico and from?
Yeah, I was born here, but my parents are from Honduras.
Honduras,
Yeah.
And you all speak Spanish? Yes. Christina and Ana.
Anna, oh, you speak Portuguese.
Anna have a very unique combination of skills, and she's able to communicate in both of our target languages, Portuguese and Spanish. Christina also knows
To get
Spanish
on
and
board with
Portuguese.
this as well. Okay, so we're going to do whatever we need to do to help network all of these initiatives.
Hi, my name is Natalia Konarski. I'm manager of interpreter services at St. Anne's Hospital. I've been at St. Anne's Hospital since 1985, so I've had a few roles of jobs at St. Anne's Hospital, and I've been through quite a few presidents of St. Anne's Hospital, so I've seen many changes. I just recently came back to St. Anne's about 2 years ago, back to the same job that I had before, interpreter services, and we provide interpreter services 24/7 in the hospital, and we have also telephonic resources for our patients when we're not available. And the community here in the Greater Fall River that we serve mostly Portuguese, and in the Greater Fall River it's mostly Portuguese from the Azores, and then the continent, and we also have Brazilian, and we also have from the Cape Verde. They speak Portuguese, but there are others that also speak Cape Verdean Creole, and we have a small community of Cambodians. So it's and of course Spanish speakers that are from different areas, but the majority are from Puerto Rico that we see in this area. So we have excellent interpreters at St. Anne's, and they are mostly Portuguese speakers that speak Spanish, and we have a couple of Spanish speakers, but they do not speak another language other than Portuguese. And we also have interpreters that speak Cape Verdean Creole. So.
Do you have any, there's a community from other Portuguese-speaking countries like Angola and Mozambique?
Yes. Very, very small, but we do have some.
Okay.
Yes.
Hello, I'm Tracy Ibbotson, and I'm the Director of Community Health Benefits at St. Anne's Hospital. So I'm relatively new to my role in community health benefits, a year into it, but I'm not new to St. Anne's. Like Natalia, I've been there a while. I came in 2002. I came on board to oversee our breast care center and a background in women's health. So that's kind of a good, good experience in health care, because a lot of the work we do is reaching out. Most of, I'm sure, your engagement is through the women. You make the healthcare decisions in the family and children. So having that experience is good. So I'm just excited to work with you. We our president, right down from our president is probably, you would ask me who's the most engaged right now in our faith-based community. All the parishes listed is our president of our hospital. He's very committed to reaching out through the parish. He's extremely religious himself and very committed to this outreach. So we have the top endorsement. We have the pleasure of having Natalia as our director of our interpreter services, and Carla Fulgerin. Just to back up a little too, that St. Anne's is now part of the Steward healthcare system. So we have our hospital, our ownership is based in Boston, at 500 Boylston Street. So we're part of that bigger network. So we have that bigger support system, and our director at that level is Carla Fulgerin, who I can't do her justice speaking about. I'm sure Natalia can speak to, but this is all what she lives for, and she's very engaged. I've been sending her all the materials that you provided. She has your copy of your. She's at a conference this week, so she couldn't be here, but she has the Kathy passed along, so she's going to be reading that on her plane ride home tonight. So,
Okay, that's great.
yeah, so we're really
Because
excited.
we think that there is a lot of potential in the collaborations between healthcare providers and faith communities and faith organizations.
Yeah, it's a way to reach out and get into through the faith and also the community health workers that Kathy's been doing a lot of work on. And someone who couldn't be here today that works for me as well is Ana Diabruzzo. Ana works at the community benefits, and she is Brazilian by birth and speaks Portuguese and really is trying to improve her Spanish skills. So she's available to us for assistance as well as.
So we're going to do our best to keep pulling all these resources in so we can network this well.
Jennifer Espinola. I've been at St. Anne's for a year next month. My main target is to get uninsured, so I help the uninsured population to get them insurance. So I do the healthcare network. Yep.
So we have here.
She's a specialist in insurance.
Yes. So I go out into the communities and look for uninsured.
Or
patients.
underinsured.
Yeah, or underinsured.
Right.
So I have my card, so if you can refer people to me, I would love it. And I've been working with. She's the boss. And it's great. I love it.
And she's trilingual. I said
Yes, she is.
Español, Portugués.
Portuguese, and I don't speak. I understand Spanish. We can communicate. I've done applications with Spanish patients, and we're fine. So, and there's a lot of Spanish. I'm seeing a lot more, not a lot, but I'm seeing a lot more for underinsured or uninsured. Yep.
Great.
But the majority is Portuguese.
We know that the re-enrollment period begins on
November
15th.
Yes.
And well, we are trying to attend as many trainings at the local level. So if you know of any, invite Anna and her team.
Okay.
Yeah, if you could give me your email, I could definitely, when I go back, there's a lot.
Because we want to go there and network to figure out how are we going to partner with the people who already is doing this. And because we know there is not full-time coverage, and so one of our ideas is to work during the weekends and after, for example, before and after Mass. And I think that, I don't know if you are able to do that, but many places that are working on enrollment are not available on Sundays. And so we will. But we want to work in collaboration so that when we are not available, we know where to refer people.
Yeah. Jennifer sees people from the community all the time.
Yep.
You this coverage Saturdays, right?
There's coverage on Saturdays, yes.
And then Sundays
on call.
On call.
Yep.
Okay.
And we are doing emergency. We are part of the pilot program in Massachusetts right now, where they get I'm going to say it wrong, but the hospital
provisional emergency health care. Like as soon as they come in, if they're eligible for it, they get insured right there and then, and they're good for medications and stuff like that right there and then.
Oh, wow, great.
So it's called the HPE program.
We want to visit with you
That's right.
to see exactly what you have available for people, so that when we talk to them in the community, we can send them to you.
I would like you to meet my supervisor, Naomi, because she knows it like the back of her hand.
We have a whole team.
We can set up a
meeting and
I would love that.
Information and
So the community organizer can hear there's going to be a lot more follow-up meetings and laying out a strategy plan and everything else, right?
Yes, exactly. So what we're going to let Anna...
So, as many of you know, the program is called Todo Juntos, and is trying to use increased health through faith and action, as you already spoken here. And so I want to go a little bit of the background. We applied for this grant through the Office of Minority Health, and we were awarded. It's a 2-year grant. We were awarded for the first year. Second year will be based on performance.
Oh no. Okay.
And
I thought there was like that thing that you press the next and they bullet comes
Yeah,
up.
but it doesn't do it. Okay.
And then the overall goals of the grant is to increase the knowledge of Obamacare, which is the Affordable Care Act, and also to get people to use our marketplace. So that's like the overall purpose of the grant. And now I'm going to talk a little bit about the goals that we have for this program. So the first goal is that we want to reduce the difficulties encountered in the health insurance for enrollment for underserved and hard-to-reach Spanish and Portuguese communities. And so we're hoping that after this program, we hope to achieve these goals, which are increase the knowledge and understanding about health insurance and how can these communities enroll, and also have more access for people who have limited English, in the proficiency. And so we're hoping for them to be more to get enrolled, and also 10% more people in our AIM population to get enrolled in health insurance. And also this is interesting as well because we know that we have a lot of families that perhaps they are not here, are here unauthorized, but perhaps their children who are born here can have access to health insurance, and many times because of the fears, they don't reach out and get their children health insurance. So we're also trying to do that to get them insured, at least whoever can get insured, for them to have that, have access to that. And the second goal is to increase awareness and knowledge of how health insurance can better help in health outcomes for Latinos. And I think many of us, know here that a lot of Latinos work they have more than one job, and sometimes their health is like a second or third priority. And so we want to make them understand why is it important to have health insurance and not wait until something happens, when the cost can be much more than what they could be paying or not paying for health insurance. So we want to get this, and so we're hoping that we are speaking to them, they are more motivated to enroll into health insurance. And the third goal is also to help churches provide these culturally appropriate outreach approaches and education assistance to increase health enrollment. So again, we know that the churches have this already great community and network going on, and so we just want to really partner up with you and be able to have this access to the community. And through this, we're hoping that the 6 churches that we already have, that we're partnering up with, so that we can increase the health insurance enrollment for underserved Spanish and Portuguese speakers, and also increase the community awareness overall of attendance of health enrollment sessions.
Yes, I think we meant there are six communities: Walton,
Yeah.
Lawrence, Pittsfield, Gray Barrington, Fall River, and Bedford.
Oh, very
Instead
good.
of 6 churches.
I was going to say,
no,
we have
6
6
cities.
Okay,
No,
very
6
good. Very good.
cities. 6 cities.
Sorry, yeah.
Very
cities.
good, very good.
And also the fourth goal is that we want to develop a faith-based model that can be reproduced not only throughout the state but also in the country, that are specifically targeting Spanish and Portuguese communities that are underserved. And so again, the impact would be to replicate the same program and offer it to our other communities and states and in the country. Yes. Mm-hmm.
In your research, because you're a wonderfully research-based institute,
Uh-huh.
how many models do we know of that are out there that are specifically nationwide for bilingual, bicultural Spanish-Portuguese?
How many faith-based
models?
There have been more in the African American,
Okay.
which have been very successful. For Latinos, there's really none, and it has been really hard to be working with them. So this is really
Yeah, and we did make a case to the Office of Minority Health in the proposal that we are in a very good position to document our work and our model, because when you think about many places in the country, Massachusetts is ahead a little bit. We have made some progress with health insurance, and so we think that now in Massachusetts we need to be able to reach those who have not been reached yet. There is a challenge to reach, but that it is precisely why we could figure out what does it work, what really works in this connection with faith-based organizations, what are the strategies that will succeed getting to those who have completely out of the system. Because we know there are a lot of people that are not connected with the healthcare providers, they are not connected with any other regular organization, but yes, they are connected, and they feel and they view faith, they're connected to faith-based organizations, and they feel that those organizations are trusted organizations for them.
That's the key.
So the
Trusted
trust, the trust that the faith-based organizations have for some of the segments of the Latino community, and I am sure this is true also for the Portuguese community that are not from Latin America, have a history of many years, many centuries of having this very close relationship with faith-based organizations. In particular, I think the immigrants feel a real connection with the faith organizations. And so we think that both the progress that Massachusetts have made in health insurance, plus the potential that we have of partnering health providers with faith-based organizations, that we can develop some lessons learned that we can disseminate to other parts of the country that are going to go through what Massachusetts already has been. So that's one of the goals, and one of the reasons why I think our proposal was attracted to the Office of Minority Health. But to answer your question, Kathy, not many models. I think that there are individual efforts, have been individual efforts, but they still is not as strong as the African American community. So Chanel knows because she has worked in Black churches. Is a completely different culture and legacy.
Definitely.
And so the part of what Chanel brings to us is that expertise on how things work.
And then also to that point too, I think that also supports that on some level is that one of the physicians that we work with the Blue Cross Blue Shield grant for diabetes patient management, especially with the Portuguese community in Fall River, is that many of his patients that are late 50s, 60s, 70s, and 80s, most of them are not at all fluent in English, right? I don't know what we're seeing at this end, but I know it and Dave might speak to that as well. But his concern is that if we're teaching them in Portuguese specifically, because many of them, when they immigrated here, especially to Fall River, were their literacy levels were challenging.
Yeah.
And so there is that very large segment of the population here in Fall River, and that would also be in New Bedford, for whom Portuguese, teaching them and explaining, and their health confidence would be so much better if they were
This is very
in Portuguese.
Portuguese. It seems that Kathy and I connected through, because I was in the car. I was saying to the team here, I was saying, people think translation is a matter of language, but I said there's different types of translation. There is the cultural translation, the linguistic translation, and the literacy translation that have to have.
That's where we're at.
So, yeah.
Yeah, but at St. Anne's Hospital, we are very fortunate to have a bilingual educator, diabetes educator, Rose Curo, Rose Rezende. So we are very fortunate at St. Anne's Hospital when it comes to the Portuguese community and the diabetes education. She is there.
And one of the things we talked about when we were partnering, St. Anne's partners with People Incorporated that absorbed the Diabetes Association under their bigger organization, and we did identify that a diabetes educator, a Spanish-speaking diabetes educator, would be something that was a gap in our community. So it was an idea that for the People Incorporated to write a grant for, and that kind of, I'm not sure where that sits, but that is a gap in terms of our community. But we have the Portuguese well covered.
When it comes to the Spanish-speaking patients, then we have an interpreter that assists the nurse when it comes to educating the patient.
And hopefully, my hope would be, coming from the community health worker perspective, is that not only do we identify some of those gaps as well, but these kinds of issues and concerns in terms of outreach and working within our culturally specific communities, that we'll be able to identify many of the health literacy issues that are around that. What are some of the targeted areas for disease, chronic disease management? what that means and implies in terms of our training moving forward, and that this is one way in which we can actually not only gather that information, but begin to, they're wonderful, rich resources there, and the more that they can train others to do the
exactly.
same,
And that's it.
the better we will be moving forward.
Yes.
And so also just to give an overview, so we're working like Dr. Lee said in these 4 regions, New Bedford, and our partnership is through the Catholic Social Services, Fall River through United Interfaith Health Action, which is Kathy, and Pittsfield Community Health Programs, and in Greater Boston through Dr. Hassan Espino, which we mentioned earlier. He will be able to serve as a liaison between the Lawrence and Waltham parishes. And so these are the partnerships that we have so far.
Yeah,
And you want to add?
yeah, well, I wanted to add that we, on Monday, Anna and I and another colleague at the Gaston was going to have a meeting, a phone meeting with the Massachusetts League of Community Health Centers statewide, to talk about also how, just like the same thing that we said with you, how do we learn more about what they are doing, because the community health centers also have people who are enrolling, and identify what are the gaps that then we can position ourselves to fill those gaps, and also to refer to each other. So that's the next big partner is going to be I think Massachusetts Community League.
The legal community, that's interesting you say that, because we are positioned, I was on the phone yesterday with Samantha Morton from the we have a medical legal partnership at St. Anne's. So we work with, the South County Justice Center. We provide actually free legal assistance to our patients who need. And so I'm going to be presenting there next in 2 weeks, in terms of one of the initiatives that we have going at St. Anne's in our community health outreach. And they actually, I've learned about too, that they're doing, there's a project and it's in the Boston area where they're doing like what we're doing with community health workers, they're doing with peer advocates in the legal arena to help patients with the social determinants. So that sort of, it all ties together, because there's a lot of reasons too that patients that are not having access or whatever, bicultural, that there are other social determinants going on that are creating them to overuse some of the health care, ERs and whatnot, because they really aren't addressing the core problems.
Right. But that's why the community health workers and promotoras, they're so important.
Exactly,
Because they will be able to address multiple needs.
And then this is a very important chart because it shows our goals, right, in terms of the numbers that we need. And so I like this chart because it gives us a good, for us to see like the population of Latinos in New Bedford, Fall River. And so here we have the percent of Latinos that still don't have health insurance. 16% in New Bedford and 9% in Fall River. And through the proposal, we said that we would be able to reach by the end of July 2,508 of these Latinos and enroll 627 here in New Bedford. And so we're hoping to in Fall River, yeah. In Fall River, we need to reach 147 in contact. That means just going after them, explaining what are their options, and the enrollment needs to actually help them apply for health insurance, and that would be 73 by July. You can go to the next. And then I broke it down here to see how it would look like per month. So I took it off from starting in November. We would need to outreach to 279 people in New Bedford and enroll 70 in New Bedford. And for Fall River, 16 outreach contacts and 8 enrollees per month. Again, that would be from November until July, the end of July.
And something that I wanted to say, and to add to that, when we wrote the proposals, we used some of the numbers that we had. We don't know how those numbers may have changed. We also don't know how many of those that were enrolled at the time that we got the data are still eligible, because some of the eligibility criteria is going to change as of in 2 weeks. I think some people now are being taken out of the Massachusetts exchange system, and hoping that they will re-enroll if they meet the eligibility criteria. So we didn't factor that in. The numbers came from the numbers of uninsured came from the reports of the Massachusetts Department of Public Health and the connectors at the time that we wrote the proposal. So we don't know. And those are the minimums. So minimums. So that if in Fall River we happen to have 200 that we can enroll, much better, because what we would need to, our goal is to have universal coverage.
And Massachusetts, correct me if I'm wrong, but Massachusetts has one of the highest percentages of residents enrolled overall.
Right.
We
Yeah.
probably lead the nation, right?
Yeah,
So you're
correct.
working on a small percentage of people that we need to capture.
Yes,
Yeah.
correct. We're working on those who have not been connected yet.
And usually these are like the underserved, like the Spanish and Portuguese,
Right.
because of their
They're usually
The barriers
afraid.
that
That's,
they- Yeah,
that's
yeah.
the main, that
Yeah,
I'm
that's
seeing,
it.
they're afraid.
yeah.
You know.
Yes, we heard that also from the cancer disparities report. Remember, we heard those as well, and all the research and work that was done on that.
Yep.
And at times, and it comes back again to health literacy, right, and our understanding and our
Yes.
confidence and all of that.
Yes, and
You know, I mean, I do the same thing myself when I enroll, and I asked my person, I must have asked him 50 questions if I asked one, and he said, "This is very exhaustive." I said, "Well, you know, it's important to me, and if I get hurt on 195, which hospital am I going to go to? You know, which hospital is going to cover me?" So my point in sharing that is we have a lot of English speaking, highly literate people who don't have a lot of confidence, because if I keep asking, is it, where is this, it's going to be part of my copay, what's going to happen here, how much money out of pocket, am I, and when you answers you get back is, well, what's the relationship you have with your primary care physician? You know, is it a good one, and maybe they'll cover it.
Yeah.
You know, so,
No, it's true.
well, this is true. See, so what my point also is that in the outreach into our communities as well, my belief would be that we have a lot of English-speaking people who would also be concerned about that as well.
Exactly.
Because I might have a mother or father who might only speak Portuguese, but I might be very fluent in English, and so now we have all of those combinations
The mix
of issues and
language.
concerns, and so it would be
Yes.
nice too if you could also tell me, you know, as well, because oftentimes as we know, that's how our family systems work.
And then the other thing is that it's about the fine. That people
Yes.
people get nervous about that if they don't understand what it means, what it entails, and if they don't understand that it ultimately they will have to pay when they get sick, that we have to figure out how to provide them with the best option in the less expensive. So that those
That's
are
right.
some
And
the
that's right.
issues. But the issue about one of the great things about having people from the community, the community health workers, doing this is that they know the community, they know how to navigate the system, they relate to the experience, and in the case of the faith-based organizations, they feel somehow protected. Does that make sense? That somehow it's different than if I say the importance of the health insurance, that I have Father Mark
Yes.
say it. If we are in New Bedford working with in the Latino community, and Father Mark say, "No, mi hijo, you know, this is gonna be good, and this is gonna be for your health protection." It has much more weight if he says it, or if you says it,
That's right. That's
than
right. That's
if
right.
I say it.
That's right.
Have you done an inventory to know what's available currently? For instance, like Health First does enrollment assistance, STAR does enrollment assistance.
All the health centers, our health centers that
Yes.
are part of the collaborative as well.
Yes. We are gonna, the students actually are working on that. So we know that, for example, the Fall River was not New
New
Bedford,
Bedford of me.
Community Health Center just was
Yes.
funded for the
With a new
for
program,
the
it's called
access
the
kids,
Health
so they
Care
were-
Access for Kids. So
Yeah.
what they're doing, they just got funded by, and what they're doing, and I think it's Fall River as well because they're so close together. They're teaching the children about the health insurance and they're sending the information with them to the parents so they can enroll. And they're actually starting next week their enrollment. So it will be for the last 3 weekends of October, and they're starting now. This is done. The grant was given already, and it's through the children that they're reaching out the families, and specifically for Latinos and for like Portuguese speakers. And this is a new program. It's called
Yeah.
Healthcare Access for Kids.
And everybody's going to be working on enrollment next week. I mean, a few weeks. What the difference with us is that we are going to concentrate on doing our outreach and our education through the faith organizations.
Yeah.
So, because we know that you are in the hospital, the other person is the community health center, but for us, the universe is going to be the faith communities.
Can you go to the next slide? And then these are the project leadership. Of course, Dr. Maria Idali Torres from the Gaston at UMass Boston. We also have Dr. Jennifer Allen at Tufts University. She's the director of the Community Health Program. And also Dr. Hosna Ospino, who is a professor at the School of Theology at Boston College. And these were also, they were also involved in the CRUZA study, which it was a study that focused on faith-based organizations to educate them about cancer. In Catholic churches. So they have a lot of expertise and will be helping us in this program. And then next, I think it was staff. Myself, I'll be responsible for seeing the daily activities of the program and supervising the students, and also the faith community coordinators, which I'll talk about later. And also we have the progress monitor evaluator, Christina, who introduced herself. She'll be evaluating in terms of like how many people got enrolled, what things are being useful or not, so she'll be doing that. And then these faith-based community coordinators, we're hoping to get your help on them because we want to hire one from every community that is already in the faith-based, who is part of the church and who is a trusted member and will be able to help us enroll people from the churches. And I'll talk more about them later in a few slides, if you can go. And we also have the communication disseminator coordinator, Pablo Goldberg, at UMass. So he'll be helping us develop, we're thinking of media toolkits that we want to disseminate using newspapers or the radio stations to help people know that we're here to help them enroll. So he'll be responsible for helping us do that. And we also have the program assistants who introduce themselves. They're going to be students working with us and helping us do outreach, events, and also assist in enrollment. And then these are the resources that we wanted to point out to you that we have. From the proposal, we have about, give or take, $12,550 to hire a faith-based coordinator. And I think Idali wanted to talk more about like how would that turn out later, like how we can hire them. And but it would be we would want it to be done by November 1st.
It's possible.
Sounds like
Somebody who is already known to the network.
And so it will be starting hopefully November 1st. And I'll go through August 30th of next year. And we also have some money to buy a laptop for each coordinator, so they will be facilitate them in terms of enrolling people to the health insurance.
So
and of course, we also have the students. Yeah. And of course, we also have the support of the students to do outreach and help.
For large events like on Sundays and Saturdays or evenings, or we will come with we say 2 to 4. It could be up to 6. It depends on the event, how large it is, so that everybody it's enrolling if we have large number of people. Because Anna told me you saw a video from California.
Yes, yes.
And what did you
so
see?
It was interesting, but this was an enrollment for March. But it was in California, and people were making lines, and they were waiting for an hour and a half to see the counselor and the navigator to apply for health insurance.
Which is why we will have standby students to call them. So we don't have to let people, Yeah.
Yeah. And then I know it's a little bit much, but you can read it after, and it's also in your folder. There's like a job description of what we're looking for the faith side coordinator. And these are just like some minimum qualifications that we're looking for. Really what we would need them is, again, to be a trusted member of the faith community, and also have some experience already in doing outreach and events. And as well as have computer skills in order to navigate, because we know that the enrollment would be through like a computerized system, so we would need them to have those basic skills to do that. And also be able to, of course, communicate in Spanish or Portuguese depending on the need of the community. And have the willingness to go and visit homes, because again, we want our time to be very flexible and for the enrollees. So if they cannot make it at a certain time, we want to go there and visit their homes and talk to them there and help them get enrolled.
We do that currently.
Oh, okay, great. And also have some a car, some means of transportation which will be reimbursed for, so they can facilitate that. And if we go to the next slide, and these are just some general responsibilities that they will have. Will be to keep daily records of activities, how many people are getting enrolled or not, and also communicate to the program manager any difficulties they encounter. And I think we can go to the next slide. And also for the outreach, we want them to maintain and expand personal networks, so not only stay local to their faith-based community, but also expand those. It could be another church from other denominations or things like that. And also able to recruit volunteers who can help them, assist them in this type of work. And also give educational oral presentations. Like we were saying that since we're thinking that it might take a long time for us to see them. So in the meantime, we would want to have like a sort of like a station. We'll be educating them about what is the Affordable Care Act, the importance of having a primary care doctor, things of that. So for them to be able to give those presentations, and also help potential have potential enrollees enroll, such as providing childcare. So we are providing that, and for our grant, we will have the means to provide childcare, and again, transportation, visiting their homes.
And maybe that the childcare and the transportation will have to be in the form of gift certificates, but there will be resources.
Yeah.
Which is wise. This is what we see all the time. This is what we need to prepare for, right? Because those who have the bilingual skills,
capacity,
are those who still have families and all these other demands and concerns, and we see it all the time. And would anticipate that in all kinds of healthcare workforce development, right? So.
Excuse me. No, so it will be based on
the community that
in the communities that so we're working with New Bedford, Fall River, Pittsfield, Lawrence and Waltham. So we will need one person there.
So one for each community.
Exactly.
Yeah.
So you're still looking to hire.
Yes.
But we would like that decision to be made by the local partners who know the community, who are trusted people in the community, and who can do this work. So in Fall River, that will be the interfaith action. We know that Kathy has plenty of people that she has trained.
I don't know how many we've trained, but we have at least, I don't know how.
So New Bedford will have one. For River, we have another person. So each city will have the resources for to hire one part-time coordinator to work during the week and work with us when we come during the weekends to support that coordinator with our students.
Right. And go ahead.
Ideally, one would be Spanish speaking and the
Yes,
other Portuguese
exactly.
speaking.
Yes. So
Um,
that's one thought, and that they can partner, as well as we the students also.
Right, I think that there's a lot more specifics and a lot more organizing around this and a lot more coordination of things. But part of the thing when we say UIA, as well as we have faith-based communities in New Bedford, obviously, and we have them here in Fall River, and they also outreach to others as well. So some of the local faith-based communities that may not quote-unquote be members of United Interfaith Action still work very closely, and we all
Yes, and that's
collaborate together.
Yeah,
And
we
then
remember from our work here for the 2 years ago.
Right, and then the other thing too is, because there are some faith-based communities in the South Coast Community Health Workers Collaborative, as well as all of our clinically based, hospitally based, and community-based organizations, a lot of them as well have worked. So we've joined a lot of our efforts and a lot of our resources and a lot of our identifying of workers and people together. So actually, you would be drawing from both of those pools of people as well, because some of the people who are in the faith-based communities are also CHWs and members and working with our organizations that are part of the CHW collaborative. See, so it's a nice pool of people who, and we're all working on the same issues.
Great, yeah. And then, so we also have the training and technical assistance. We'll be getting a lot of our training from the Boston Public Health Commission, and to do outreach and enrollment and eligibility criteria. And also in the Gaston, we want to provide them on how to present like health education and how to reach Latinos, better strategies to do that. And also language-specific media outlets.
How to train them so the coordinators and the volunteers to be able to use those, to have those skills.
Mm-hmm. Now, also too, just to be clear as well, is Father Mark from Catholic Social Services, who's also involved in prison ministries, works in New Bedford, works in Fall River. He did with the Mayan community, with the Latino kids. I mean, he's very well connected. So my belief is that Father Mark will take a good deal of responsibility and initiative. So we will work as a team down here as well.
Right.
My role will be very specific or very limited to X, Y, and Z, but all the rest of the contacts that we'll put everybody in touch with, working as teams.
No, we think about New Bedford and Fall River together, right?
Yeah, we do. We do.
Because that's how the image that I got from my first contact with you and Father Mark is that you always work as a team.
Yes. Yes.
So each city will be able to hire a coordinator, and of course you can do a team.
Do you have anybody in mind, Kelvin?
All I have is a great number of people that I know that I believe that are bilingual, bicultural, that would have the skill sets of a lot of things that we would like to see in this. So, for example, one person I'm thinking of, but let me just premise it by saying this as well. What we are finding, and one of the things, if we get our Healthcare Workforce Transformation Fund training, if we get that, is that it's a lot of our people now who have the skill sets to do many of these things that we're looking at, outreach, the training, the literacy, the education, and all of those, are now even under some of the other pilots that we're working on, and I'll use the CHWs involved in 2 different diabetes patient management programs. They're in organizations, they're highly skilled, and now what we're finding is, can I have your CHW for 15 hours? Can I borrow yours? So now we're sharing a lot of small resources, and now what's requiring is a lot of
Well, for somebody that maybe
coordination.
Yeah, or maybe someone that's already identified that's got the skill set that's working 20 hours and they get this opportunity for 20 hours. Now they've got 40 hours of employment, but.
Right. I mean, so
It's a local decision.
Yeah,
We want it to be reflective of the experience of the local community.
that's right, and all the places where they will interface, right, as well. So, So as I said, there are a number of people who couldn't make this meeting, but they would be part of the follow-up meeting to continue
Right.
to lay out the plan and the strategy
Yep.
and how because there very well might be people within our hospitals and our health centers who are very active in their parishes that, that may or may not be part of the collaborative that would have
Right.
that skill set to do that moving forward.
We don't have much time, it's supposed to start November 1st.
I mean,
It's flexible, right?
flexible. It's flexible. It's
Our-
flexible. It's
yeah.
flexible. The reason why it was my idea because we have already a training session scheduled with Boston Public Commission for November 4th, and we said it will be wonderful if we can get them. But if not, then we will do the training for that person later on.
Yeah.
So we have to be flexible because every community is different.
So I'll leave this for last, 'cause since I think that we can say more. But so again, yeah, our training, first training will be on November 1st, and it would be great if we could have these people by then. But if not, it's okay. And we also would like to develop a calendar of activities that are going on in the churches for the months of November, December, and January, so we can already start planning the days that we can be there. And we plan to start the outreach in November when the open enrollment starts.
Yeah.
And we want to have monthly conferences calls so we can report to you, like, how many people have enrolled, have our celebrations.
There you go.
Kathy knows as a community organizer we need celebrations.
Absolutely.
Seriously.
And for Eddie also to see, identify areas of how can we better improve.
Right.
And so I'll let Italy talk about like the
Yeah, but
hiring.
I think that at the local level, our partners will decide that if they want to hire the faith community coordinator through us, we can do by hiring that person as a consultant of the Gaston Institute, or we can also do a subcontract for services with the local faith-based organization.
So
You have an option.
Yeah.
don't. It's frightening when you say you.
I know, but
I say we. I say we.
Yeah. Basically, when I'm saying the local community
Yeah, that's good.
has,
Which is as it should be, right?
has an option
Yes. Which is
of deciding what to do and how to do it.
So if you have any questions or any comments.
You mentioned it a little bit earlier in your statement about connecting to PCP. That's one of the initiatives that Jennifer works on as well. Because we
great.
find that, it's not a requirement, correct me if I say anything wrong, in order to get insured or get enrolled to have a primary care. But it's a huge advantage because then you're going to be encouraging more preventive care. They're going to be more apt to go to their physician for a checkup or whatever before something becomes a crisis in the ER with the, utilizing the emergency room as their primary care. So Jennifer's working on that. What do you find? What are your obstacles?
Well, like getting in contact with them to get.
Well, when you
A lot of them, they think they're healthy. They're like, I don't need the doctor, like they.
so I think that's an education
That's-
piece.
yeah, that's-
Understanding that.
That's the majority of them,
Yeah.
like, I'm
I don't need
healthy.
a doctor now.
I'm not sick. I need to work. A lot of them, they
Yes.
can't take
Yes.
time out of work.
Sorry, and the question be, are you mostly speaking, are you hearing this from mostly men or women or this or equally?
I would say men.
Men,
Yeah, because they believe they shouldn't be sick. They're the ones that should support the family.
Yeah.
So, and more Portuguese, like that I've dealt with. I haven't dealt with a lot of the Spanish community, but a lot of Portuguese, yes. The men, they believe they shouldn't be taking time out of work. They don't need a doctor,
Because when you say about connecting to the primary care, you say they're going to have they'll have a physical or an annual care,
Yeah.
and they don't want to commit to that, or
I don't want to speak, but what I get is like they're embarrassed, like they need seeking help, like for their health. They're like, what I get, like they're a man, they shouldn't be, they're strong, they have that mindset, Yep, they have that mindset, like they should be protecting the family.
And I think I could be very wrong about this. But I think the age group that's the most challenging, even nationwide, is also true for our populations here in Fall River and New Bedford. I would say, I could be wrong about this, and so don't quote me on this, but my sense is as I listen to some of the people in our health centers, right, who have the resources, it's very difficult to get the 18 and the 20-year-olds and the 30-year-olds to come in. Even when they try to, that will be a struggle. That will be a challenge.
Yes,
It'll
I'm
be a challenge.
hoping that some of the churches will have youth groups, or we can actually work with the mothers who have children at home that they are 18 to 30 males that are resistant or afraid or nervous about it, that we can work with.
Right, and I think I'm also thinking along the lines as well that now you have down here in the northern end of town where St. Michael's is, right, very large, group of Portuguese-speaking people. You also have a school there, so that's a wonderful opportunity to utilize the school as well, because the school is very connected to the church and the church to the school, and so now you have a lot of wonderful opportunities to work through that venue and avenue as well. So it will take, from an organizer's perspective, at least in terms of this, I can easily put all of us, or as well as I can, through our UIA faith-based communities as well as others like Santa Cristo and some of the other area communities as well. But I will also do my best to identify those schools as well, especially in New Bedford or Fall River. And I instantly think of St. Michael's because they have a very active school. So you would have very, very large numbers of people.
And they have a high school?
No, they do not. They do not.
They do have the smaller children.
Just the elementary schools,
Elementary
usually
school,
pre-K, K through grade.
Espírito Santo too. They're Portuguese,
Yes,
and they have the school too.
Yep. So those I think would be great opportunities. And the best I can do is to put us in touch with them, talk with them. I'll have Don Meir, who could join us today, who's also co-chair of the South Coast Community Health Workers Collaborative as well, and he's now the executive director. He's the pastor here at this church at First Baptist, but he's smart, very resourceful, very good, and we will do our best to connect our faith-based communities and the resources that we have to the project.
Now, Kathy, correct me if I'm wrong though, but what they're looking for is us to identify a person to take on that role. They're willing to, you know what I mean, a coordinator.
Yeah, I don't know how, I would need
You know,
more
I think the
specifics.
first step is probably identifying that person. I don't know, maybe I'm wrong, because I'm always like task-oriented. Let's get to what we need to do.
Let's get to it, right. I don't know what you're looking for in terms of, I thought this was just an initial thing we have,
yeah.
but if we can discuss some of this moving forward, that
but
would
the
be
first-
good too. And
I think that the first thing for the local group that have been working with the training the community health workers, it's to figure out if they want to do a subcontract or do they want to send the person to us, and then identify the person. We can support your interviewing process. We can, if you need, if you want to set up an interviewing process, if you have 3 or 4 candidates and you want to, we can come and support you in that. Meaning,
okay. And I don't know, I know that at least in terms of what UIA is doing with Father Mark and Catholic Social Services, and in terms of, I think we needed more clarification, but the more that we can do, if UIA's role at the moment is more of a referral, or even from the collaborative referral, so that you can, choose your best candidate for that would be, at least from my perspective. And I have every confidence that Father Mark might have some people in mind as well, and others.
Sounds
So
like he's a key player.
yes.
well, yeah, because he is our main partner in the Bedford, even though he's also worked with Interfaith Network.
Is he New Bedford based?
Yeah.
Well, he's at the offices he is in is there, but he's also in the office up here in Fall River. Catholic Social Services has 2 sites.
Well, that I didn't know.
Yes, they have 2 sites.
So
One in
he's
Fall River,
bigger.
one in New Bedford.
Oh, okay.
So it might make most sense to have Catholic Social Services doing the hiring and
That's right.
Okay.
having-
You know what I'm saying? That was my sense of it.
Okay. All right.
rather than UIA.
Okay.
UIA will support, UIA
Yeah.
is, we're not a service organization, right?
I know.
Yes.
Yes.
So, and any of the others for whom, maybe some of our other collaborative members, right? In
Yeah.
the CHW collaborative also are knowledgeable about faith-based people. So for example, Anna, one of our CHWs who's heavily invested in the YWCA, did extremely gifted talent, Portuguese speaking, English speaking. Now she's being shared through the Y, and I'm two diabetes patient.
Yeah.
So how much more energy does she have?
She can
But
have, yeah.
she would actually be an excellent candidate
Yeah.
for that to happen.
Yeah.
And just so you would know also, if we do get the workforce transformation grant, that she, along with a number of others, would also be the trainer people that we would be interested in
Yep.
training moving forward. So again, another short way to say that is we have some really great candidates to pick from. Or you might decide you want to pick 2 or 3.
Yeah,
It
but
might change depending on the resource.
That's exactly, and that's why.
Is that making sense?
Yeah, and that's we are open to that too. So it doesn't have to be what we wrote in the grant was one, but it could be the resources could be split.
Right.
It also I wanted to say that we will welcome when we do the trainings.
Mhm.
We will welcome your community health workers
Okay.
also for the trainings, even if they are not part of the.
Right, that's good. And
Of the project, because we want to use this opportunity also to build capacity in the community.
That's right. And I think when you look to see that St. Anne's, obviously, Stewart St. Anne's, when we first started to speak about this, I know at least in being on the board there as well, that you do have an outreach to Santa Cristo. I think it's what UIA would bring to this is the knowledge of all the faith-based communities, the pastors, the interface between our hospitals and health centers out into the faith-based communities. And if this is a richness and a resource, then obviously the collaboration is crucial.
And then if the coordinator, all the coordinator has to do is work like with like with Jennifer, and we could be a resource to that coordinator.
That's right.
We could say to the coordinator, if you can't capture these people at the, at the mass, like she said, they can be referred to the hospital because we'll assist them.
That's right. So it's the resource source for you. Tracy, Tracy, you say it, because you said
Well, I
it.
was just going to say that, again, I keep going back to, I think the first place to start is identifying a person, or a trusted member of a faith-based, that then can begin to do the infiltration work and utilize us as a resource.
Right.
In case you have a situation where maybe the contact is made, but they're not able to come to the mass because they work on Sundays. We can be a referral. You can refer to us, and we can.
Exactly. So
Yeah.
we have
That is the vision of
And the other thing is too, to
that is exactly the model. The model is that we talk to Carmen, and Carmen has a commitment after mass, and she wants to get enrolled, but she cannot do it today. That we say, these are the places where you can go, and then you know the organization. So we will have the list from you, and we will say these are the people that enrolling. This is the times, and this is the places, and yes, exactly. And then you will have people who you cannot reach during the day that
We can refer to your
on
project.
Sundays to refer to us.
And that's the role we would understand as what UIA could do, as well as identifying the resources and making the connections and making right now. This is a great connection,
exactly.
perfect clarification how we would want to do this moving forward. Laura Carew, who's bilingual Portuguese English. She's the sleep tech at the hospital. She's a CHW. She's been working with the veterans in New Bedford around all of these enrollment issues, around veterans administrations and enrollment issues, who might very well be a candidate. So these are the kinds of that we could make. We could make the referrals and then allow all of this networking to help with the networking.
Exactly.
That's what our role would be.
Because this is going to take, to be able to enroll, to do an universal enrollment, it will take the work of all of us.
Right. And I was just going to say
Working together and in collaboration.
Right. And I was just going to say too, because I know what it's like to run grants and generate. You have to generate your data. If they're referred to us, you know, from a faith-based connection, we would keep that and recognize that and refer it back to you to, you know, because of your work, this patient became enrolled.
Right,
And you know what I
yes.
mean, give you the credit for those numbers, because you got to
Yeah.
meet your numbers.
Exactly.
We'll keep the documentation of
that's
that.
very, yeah, and everybody, so we are here to support each other doing this going forward.
And I would just also say, at least from UIA's perspective, if the coordinator comes from the faith-based community, or it's a faith-based community person, or one of the centers or the hospital or whomever that's in contact, I don't feel that UIA trusts Gaston and Father Mark to make this happen the way that's going to do justice for everyone. So UIA is would not want to hire that person, right? So UIA would be happy if that hiring was done and Father Mark is overseeing it,
Okay.
Catholic Social Services
Okay.
is, not UIA.
Okay.
Okay, simply because we're not a service organization.
Okay.
Okay, from that
Okay.
perspective.
From that, okay.
We will definitely support from the CHW perspective, the collaborative perspective,
Right.
and our membership and any of the other faith-based communities that we come in contact with.
Okay. Or
So that we can make those
populations
referrals and with confidence, right?
Right.
So so for example, down here for the Brazilian community, when the pastor here, Don Mir, okay, is here and he talks to the pastor downstairs and lets him know this is wonderful. When Jenny Rios from the, who actually did one of her placements with St. Anne's, right, Jenny did, from the cathedral community, is doing things. She left there after working on some key informant interviews and went to another faith-based community and did some key informant. Those are the ones that Father Mark translated for the 5-year strategic plan as well. So these are people who would be invested, would be committed.
Yes, and that's exactly
that's the
and
kind
that-
of resource that we're going to refer to you.
Right, exactly, and that's what I think it is. Somebody who really is committed and who understand the relationship between faith and health insurance.
Right? Okay. So we will do our best. Don, myself, and the new leader, Raylene, who couldn't be here today, will do our best to identify and connect the coordinator and everybody else and your team here to those people and say, we're the CHWs connecting this healthcare initiative back, okay, back and forth. And I think if we ask them, they will be welcome.
Tell me about the workforce development project that you are hoping to.
We applied to the second part of the implementation grant, right? With Commonwealth Corporation
Yeah,
in
we're
Boston,
not
right?
we're not familiar with.
Okay, so that's the Healthcare Workforce Transformation
Okay.
Grant, and we're asking we wrote a grant for that, to train more CHWs, and especially in particular, to train the trainer, because
Right,
it's
right,
becoming,
right.
it's prohibitive in terms of the
Yes,
cost to do
yes.
that as well. So we're going to identify between 6 and 8, we're probably up to 10 now, bilingual, bicultural CHWs who have a lot of experience and background to be part of the train the trainer. They'll turn around and also actually co-teach, co-design some of the other trainings. We've also inbuilt into this over a 2-year period of time disease-specific things around PD asthma, cardiovascular disease, fall prevention, asthma, all of that as part of, so that they can then, all of this will be totally aligned with the Board of Certification for Community Health Workers it's pending. We hope that it'll come down soon so that they could be certified as community health workers in the state of Massachusetts moving forward. And all of these individuals at times would either be working in community-based and or clinically based settings in Fall River and New
There's
Bedford.
a commitment to hire them after.
Well, there is no necessary promise, but that they would be, if moving forward, which is part of what the grant would require, that they would be considered as first potential hires within the healthcare community at large.
Well,
Did I leave
that's
anything out?
That's a wonderful, great idea.
What would be helpful, I was going to say too, for my perspective, would be if you, in doing the work you're doing in the outreach, if you come across some unintended consequences, if you uncover some issues that these faith-based communities have that aren't necessarily like the lens I'm looking through to think, they must be concerned about their baby's asthma. You find that they're more concerned about I don't know, something that's going on in their daycares, something that you didn't expect them to sort of express, that you could give us the information that we could then address. Sort of, as I mentioned earlier, I'm doing more work with the legal and looking at more of the social determinants, try to get some of the root causes.
Yeah.
So that would be helpful.
In your legal team, did you have people with expertise in immigration issues?
Say that again?
Yes, and with the legal team coming, that's down at the.
Oh, yeah, the medical legal partnership, yes, we do, they're,
Yeah,
yeah,
people
they're the
that-
justice, they're the justice center, so they actually can assist on
Immigration
issues.
Yeah.
And I think that's the richness, I think, of this kind of model as well, is that CHWs oftentimes see up close and personal the issues that the physician and or the hospital and or the clinic that they don't see, and it's a very safe and a very effective way to say, well, we might be looking at this issue where in reality it's this one.
Right. Or we're just dealing with symptoms.
That's
And
right.
they're gonna uncover the root cause, you know?
And that's really what a lot of what we do as CHW is really to get into the root causes of things.
As an example, with the lawyer on the phone
Yesterday, she said, when like a hospital does surveys, we look at a certain way, but they actually did some surveying outside of the hospital to the communities, and they realized that the community was very concerned about bullying in the middle school grades. And why they were so concerned about that is because the bullying to the younger children, the vulnerable children, caused them, they found, the parents were concerned that led to the children, more gang involvement, because they need that security and that, and so bringing that information back to the hospital made an investment, not our hospital, this is just an example, but the hospital made an investment and paid for or subsidized an anti-bullying campaign or teaching in the schools, because that way they're addressing a root cause of, why there's so much gang behavior and violence in the community. It's got to start, at the education piece and really identifying where you might think in the grand scheme that's a hospital wouldn't necessarily underwrite an anti-bullying campaign, but in the long run it has health long-term health.
Everything is connected.
That's right, and that's why we see this as one whole.
Right. And this is how we need to work together, because everything is.
Yeah, and we just have to see the people that have the money to see the connections.
Yep, exactly. So Father Mark didn't make it.
No, Father Mark didn't make it, but that's okay. He's a good man. He'll be around. So do we want to set another meeting after this?
Yes.
Then? So that we can lay out more specifics
Yes.
and we can get more people.
A working meeting.
A working meeting, a very good working meeting. That would be great.
That's where we can have our goals, petition, and then the people who know best this community can suggest how to go about doing some of these things. How to go, for example, about finding the men that work in the fishing industry that have 2 or 3 jobs.
Yes, Father Mark would be very, and as would Helena.
Yeah, I think some of the people who aren't here today.
That's right.
Yeah. We'll have at your next meeting.
So that that's working.
Right. We will, and always know that, had I been able to invite more people, depending, but I invited some key people.
Key people, yeah.
Right? And then
I can see that.
And the rest will be more key people.
Exactly. And then we can
so that those key people, so that they can begin networking with each other, and we can move through this strategy as we lay this out.
So that would be good. But also we love to have a conference call with Father Mark and you to talk about the coordinator ideas about the coordinator.
Oh, okay. And I will bring a few more people. Kathy never has a conversation by herself.
I know.
I
can see when we were writing the grant.
No.
Kathy, we're talking to a lot of people.
We're talking to a lot of people. That's right. Only because the good part about that, in terms of organizing, is that everybody then can be part of it from the beginning.
Yes, exactly.
As it moves forward, and then everybody sees what's in their self-interest, so
Right,
it will accrue to everyone's best interest.
Agree.
Okay.
So when we have a conversation, it'll always be 2, 3, 4 or more. And if I could have gotten our friend Ron O'Connor,
Yes.
the regional director, who's also very interested in this and is
Yes.
also very committed to the collaborative as well.
And we want to talk to him
Would you come be part of the next meeting as well?
I can be.
Yeah,
I
that'd be
don't know,
good.
you know, if we're not as much of a key player, you know, we're the hospital.
Well, you see what I see, but I see all of us as key players
Yeah.
because even, so for example, because you have Laura that's working at the hospital, you know, who works there part-time as the sleep tech, who's bilingual, who's
Yeah.
gone through these trainings, and Jenny who, see, it's the small
Right.
connection one-to-one that makes this
Yeah.
all work.
Yeah.
And we will also be interested in knowing about the legal immigration, like
Yeah, you're learning more about.
learning more about that. Yeah.
You're interested, or
Yeah, for us. Yeah.
For us,
to be more educated.
Well, that's
on
the other
that.
thing too, though. If you encounter,
If you get some of these really complicated cases, that's when you can use us too to refer
Yeah.
off. We have a silver bullet at the hospital called Naomi. And, wouldn't you say? Yeah. And she's extremely connected, okay? So you have a case with a very difficult case and all sorts of things. You know, you need to get to Naomi because I can't reproduce her expertise, you know what I mean? She is extremely, you know, they have a situation where they have a hotline they call when they have a real hardship case. They know who to contact at the state, who to talk to.
Right.
And
Because,
those
you
are
know,
the cases.
one of the things that we know we're going to encounter are mixed status families
Mm-hmm.
where the parents do not have authorization to be here in the United States, but the children have been born here and they may be eligible for
well, the children are definitely
For the-
eligible.
for the insurance. And so how do we
Yeah.
then through the faith-based networks
Okay, so
ensure that this family enroll their baby or their child, while at the same time ensure them that the information that they're going to provide us is not going to be used to deport them.
Right.
You know,
Right,
those
and-
are
Yeah,
the cases.
That's
tricky.
okay, so these are the kinds of things that people like myself and others in the collaborative would be a good resource for, because what we could say to you as well is, on this kind of case, if it has the kinds of determinants that you're talking about, that with documented bilingual, especially Hispanics, right?
Yeah.
That, you know, that's a resource. So now we're identifying more resources with and for each other. So that's a resource. So then you have Father Mark, who's very well aware within his community. Then you also have the diocese, that has large numbers of them as well. So it's Catholic Social Services is well equipped to deal with that as well. Catholic Social Services as well, the resources there. You know, there could be even better referral and
Right.
resources
Yeah.
and resources that are used around that. Then Helena at the Immigrants Assistance Center. They also work not just in New Bedford, but also in Fall River. Has a long-standing history of the Portuguese community, but also has an extremely long-standing history now as well with Hispanics as well, and all of those issues that are around that. So they are wonderful, excellent at problem
Resources,
solving,
yeah.
resources.
Yeah.
And then all I really need to do is to say, here's Helena for this, here's the hospital for that, here's the center for this, and a lot of those issues, I think, will be a lot easier to problem solve. Is this?
Yeah, it makes sense. It makes sense. It makes sense. Yes, Megan, we are really happy. I'm touched by the commitment to work in collaboration.
Yeah. Yeah. Well, that's all I can really bring to the table is the collaboration. Okay. All right.
Yeah.
So okay, definitely that. If we can get, I'll do my best to gather some more people
Yeah.
together
Yes.
for this. That would. Yes, Helena, Father Mark. All right.
Let's talk about this.
And if
Yes.
Hiring.
Yeah. So
what I think would be ideal if it was a mix. Someone who's in and of the community. She was at Health First. She's now at St. Anne's. Whether or not she could very well belong to a faith-based community, and then one of our faith-based
but
community people.
we wanted to be very knowledgeable and trusted
In the faith
in the
base.
faith.
That's where I think Father Mark would be
Yeah.
the one with that.
Mark will give that to us as well. But I think in terms of when I was talking about the team, whatever that team might look like, however that gets constituted, what we would probably find is you will have trusted members of their community. You will have trusted members of their community. And I think, as I look at our demographics in both cities, that the Portuguese, I think, would be less of a challenge for us. I think the Hispanic community, you'd have more access, but it would be more challenging in some of the other areas that we're looking at, right? So each one of those has its own challenges.
Yeah, and there are these, my impression is that...
Jennifer's last name?
Espinola, I have her card.
Oh, very good.
But I'm not recommending her, because she works 40 hours and she has 3 children and
Yeah.
she's a single
See,
mom.
this is what we're encountering.
So what we need is somebody that can work 20 hours during the week, because the weekends
And this is
You have to be someone that's very flexible.
That's me.
have to be very flexible. Yeah. Tracy.
Good, thank you, Dave.